get started. We'll finish the anatomy of the heart, and we'll do the cardiac cycle, the physiology of the heart. Here's the anatomy you gotta know. All right, these two up here, they're the main vein of the neck. Like you can see on the picture, it's the internal jugular vein on the right and on the left. Left internal jugular vein. That's the deep one. The one you can see bulging out of your neck is the external one, not the internal one. I'll teach that later. This is the main vein of the neck. It actually drains all the blood from your brain. So, right IJV on the other side. These two that merge with it, this is the left and right subclavian vein. And the one on the right. Right subclavian vein, SCV. The jugular and the subclavian, they merge to form brachiocephalic vein. Left brachiocephalic vein and right brachiocephalic. Anyways, they both merge to form superior vena cava. So this is a heart lecture, but these are the great vessels that are really close to the heart, so we still teach them. They're on the models. They're on the heart models. The blood vessels are on the heart models. And the brachiocephalic left and right are different. Now, well, just tell me this. Which one's longer? The one on the left or the one on the right?
Right.
Try again. The one on the left is longer. Remember, the left, as you look at it, is on the right side. So this is always the patient's perspective. What if for some reason you had to chop off your left arm? And the doctor looks at you, yeah, we're going to chop this arm off. Yeah, it's the wrong arm. Left and right, always the patient's perspective. Now, what's the reason? Why is it longer? Think about it. The subclavian, the superior vena cava is on the right side of the heart. So if you're on the left side, you got to go a longer way to get to the right side. So there are some differences because things are on left and right. Not exactly the same on the left or the right the whole time. The other thing you can take away from this figure are all the little veins that drain the chest wall. These right here. I would note azygous and hemiazygous. Azygous vein, accessory, hemiazygous vein. Okay, both of these drain into superior vena cava, SVC. So I always use SVC as an abbreviation for superior vena cava. If you throw in the heart and the other arteries with the veins that we just outlined, well, basically you get this picture. This angle where the jugular meets the subclavian That's kind of behind the sternoclavicular joint. So if you feel your clavicle, and you feel right where it kind of meets the manubrium, that's kind of where you are in the neck region. The other thing is, those subclavian veins and arteries, they're on either side of a muscle called the anterior scalene. The anterior scalene? The anterior scalene is a neck muscle. But I want you to know it because the blood vessels are right next to it. Scalene means ladder. The muscle looks like a ladder. Well, anyways, we should know it as a landmark. The subclavian vein is anterior to this muscle. It's in front of it. The subclavian artery is behind it. It's posterior. Now think about the name of the artery. Subclavian. It's referring to a bone. Which bone? Clavicle. It goes under the clavicle. You know where you can feel your clavicle, right? It goes right under there. However, as soon as it passes there, you're out of the neck and you're starting to get into the armpit, okay? If you had a whole arm here and I was dissecting, I could look down the armpit and I could follow the artery all the way till I see that muscle, okay? So the anterior scalene is shown there. It's shown here on the model we have in the room. It's the model, it's back there somewhere, yeah. So it's shown, okay? You can see the subclavian artery behind it, subclavian vein in front of it. This one doesn't show the anterior scalene, but it does show all those blood vessels there. So I have a lot of models in the room that show the great vessels of the heart that are very close to the heart. Now, when we study the heart in the heart dissection lab on Monday, oh, by the way, since I'm mentioning that, be sure to be dressed appropriately for lab. Be sure to have eye protection in particular. When you remove the human heart, you have to cut all of these blood vessels to remove it. Subclavian, superior, inferior vena cava. You also have to cut 1, 2, 3, 4 pulmonary veins. You have to cut the aorta, pulmonary trunk. And this is, I kind of put this next to it, the empty chamber there. Here's the heart. This is what you'll get. And it's important to know the surfaces of the heart before you make any cuts in a dissection. You can identify a lot of things without doing any dissection. Okay, and just be able to tell the different surfaces. Start with the anterior surface. Also called sternocostal surface, because it's right behind the sternum. Okay. Now the anterior surface, the first thing I will look for is, I already mentioned this, I'll write it again, the anterior interventricular sulcus. It has fat and coronary arteries in there. But anyways, you find that, and you found the ventricles, basically. Because if you can identify that, that's that's the right ventricle, that's the left ventricle. So these different surfaces, let me show you other pictures of the anterior surface that we have here. I put the, okay, so what we gotta do is go out the door and turn that way, go to the parking lot.